Good afternoon. Welcome to this webinar on healthcare compliance. My name is Kishore Vaswani, and I'm the Chief Executive Officer of ControlCase. I really appreciate the time you have taken today to attend this webinar on healthcare compliance with a special focus on HIPAA and HITRUST. A few housekeeping items before we get started. As we go through the presentation today, please feel free to ask questions by typing in the questions window, or if you are having any audio or visual difficulties in viewing the presentation, please type it in the window and our moderators will be looking for any systemic issues within the presentation system. Our webinar today is expected to run in the 20 to 25 minute range with ample time for Q&A after we have gone through the presentation here. That being said, thank you once again. We invite you to visit our other presentations by visiting our website at www.controlcase.com. Our agenda today really includes talking about healthcare-related regulations at a high level. We're going to talk about HIPAA. We're going to talk about other terminologies we have heard, such as HITRUST and omnibus. We will also talk about high-tech, and eventually we will talk about how all these tie into each other. As we go through it, as I said, please feel free to ask questions in the Q&A window. First, let's start with HIPAA, which is a common terminology used out there and a common regulation that exists out there. So HIPAA, or the Health Information Portability and Accountability Act, has actually been around for over 20 years. This was passed by Congress back in '96, and the overall aim of HIPAA was to ensure that at the highest level, healthcare information is protected. Specifically, there were multiple components of HIPAA that we'll talk about today, but at the highest level, there were technical components, physical and administrative components besides the privacy standards. As we go through the presentation, and specifically when you talk about HIPAA, you will keep on hearing about certain terms such as business associates and covered entities. Business associates are really third parties and vendors, and covered entities are really entities such as doctors and other providers, clearinghouses that at the end of the day fall under HIPAA. At the highest level, HIPAA attributes and makes sure that the responsibility of monitoring HIPAA lies with everybody in the ecosystem. And for at the highest level, the job of protecting healthcare data lies across all the parties in the ecosystems, including third parties, vendors, or business associates. When we talk about HIPAA, the next other few terms that are consistently used are high-tech and the omnibus rule. And when we talk about that, high-tech really refers to additional conditions that were passed and additional clarifications that were added to HIPAA, specifically in the context of extending and ensuring that security, privacy, and breach notification applies to business associates or third parties. It also established penalties and breach notification guidelines, and at the highest level, ensured that anyone in the ecosystem, including third parties or business associates, have a responsibility to protect healthcare data. The omnibus rule really implemented high-tech and it really finalized HITECH, and it formalized what are the enforcement provisions for breaches in case they do happen when it relates to healthcare data. It also clarified that the Health and Human Services will actually determine the absolute maximum for penalties, and really laid down that both covered entities and business associates are liable for the acts of business associates and their subcontractors. So again, there's HIPAA, which is a law in 1996, HITECH, which was passed about 7 or 8 years back, and really was formalizing the security, privacy, and breach notifications for business associates and establishing a framework for data breach notification. And then the omnibus rule really finalized and implemented the HITECH provisions. And so I wanted to outline that because some of these terms are used in the healthcare compliance field a lot. We will be distributing a copy of these slides and a copy of this recording, and so you will have access to these specific numbers and the links from where we got it. But there are various well-defined fines and penalties as part of HIPAA or HIPAA violations that exist within the United States. I will not go through each one of them, but the violation and the severity of the violation really depends on a couple of things. Number one, was it due to willful neglect, or was it not due to willful neglect? That's one key data point based on which penalties are determined. The second kind of key point was if it was corrected within a required time period. And obviously, if it was because of willful neglect and it was not corrected within the required time period, obviously the penalties are higher than if it was not, or if it was related to something that was not related to willful neglect. So again, and there are penalties that basically define the minimum and the maximum per violation, and then annual maximum. And I will make sure we distribute these slides so you will have this handy early next week. When I talked about it earlier, I mentioned that there are 3 key components to HIPAA, and we'll talk about that. One is the privacy rule, and when we talk about the privacy rule, it basically ensures that privacy of healthcare information of individuals is safeguarded. It basically sets limits and conditions on what can and cannot be disclosed without patient authorization, or more rightly so, a framework around what can be disclosed around without patient authorization, and it gives patients rights over their healthcare information and the right to request corrections and copies of their healthcare records. It also requires that for business associates, breach notification guidelines. It also requires disclosure of any breach to the right agencies in case of any problem that is found. Of course, that goes with the right, that includes the fact that the right forensic methodology also needs to be applied after that, including the right accounting and procedure for disclosures. From the second component of HIPAA is the security rule. We talked about the privacy rule, and privacy has been in the news lately, and privacy talks about the right of an individual to their data, in this case, specifically healthcare data. HIPAA then talked about the security rule, which has really bearings as it relates to information security, which then it has 3 kind of components. One is the technical component, which is things like authentication, log in and log off, encryption, and the technical safeguards that are used to protect PHI or health information. Then you have administrative safeguards such as password management, anti-malware, antivirus, ensuring that you have a risk management, risk assessment done within the enterprise, and making sure there is contingency plans and business associate agreements. And finally, the physical safeguards, which talk about things like cameras and badges and a facility secure plan, ensuring that media is appropriately encrypted, data backup and storage, and so forth. So we talked about the privacy rules, and then we talked about the security rule, and the security rule itself has three components in it. The next piece, as I mentioned, there were three high-level components, and the third one is the breach notification. The breach notification talks about if there is a compromise in either the security or the privacy of protected health information or PHI, what are some of the notifications that need to be done and in what manner? So HIPAA does require that the notifications be made quickly or in the right manner and to the right agencies. It also has thresholds of how, if it's more or less than 500 records, the way you notify could be different. At the end of the day, it say if there is a breach and the breach notification guidelines are not followed, that will again result in fines as well. And then there are some NIST specific guidelines that help in this kind of breach notification arena as well. From a HIPAA requirements perspective, they also apply to business associates and subcontractors. So business associates, subcontractors, service providers, there are different words that are used for sometimes the same type of transaction where a third party is providing some services, especially that come in touch with healthcare data. And so HIPAA requires that covered entities must implement a monitoring program and assessment of their subcontractors or service providers or business associates to ensure that any healthcare data that they come in touch with and they have outsourced from a process to a service provider perspective is appropriately protected. The intention is very clear. You can outsource business processes. You cannot outsource risk and security or the liability of something going wrong because of a service provider providing services to you as a covered entity. So again, BAs and subcontractors or service providers are also covered under HIPAA, and of course, they're subcontractors as well. So before I get into HITRUST, let me summarize what we talked about in the context of HIPAA. We talked about HIPAA as a whole. We talked about HITECH and Omnibus and how those implemented HIPAA. Then we talked about the privacy rule, the security rule, the breach notification rule, and we talked about the fact that service providers and business associates are also covered by HIPAA. Now, let me move on to the second topic within our presentation today, which is HITRUST. And at the highest level, when we talk about HITRUST, the overall objective of HITRUST, among other fields and other regulations that they target, one of the methods that HITRUST has put together, one of the areas where companies can be certified is the HITRUST regulation. Because HIPAA, while it's a law and a standard and it's a law of the land and everyone must comply with it, it's not really a certification. HITRUST Alliance has done a great job of putting together a certification program that covers various fields, but specifically for the context of our discussion, healthcare. And so while you cannot be HIPAA certified, you can be HITRUST certified. And it is really a non-for-profit organization whose mission is to champion programs from a healthcare risk assessment perspective among other industries. The key focus is to make sure that in the ecosystem, sufficient amount of due diligence is done when it comes to protection of sensitive information generally and protected healthcare information specifically. And it also being a nonprofit and being a certification body, it is able to facilitate sharing and collaboration among various organizations, and for purposes of our discussion, are among various organizations that fall under healthcare regulations as well. Basically, at the overview level, HITRUST, as you can see in the last bullet here, talks about there is a certifiable framework that organizations can use to be certified against. It works, the HITRUST Non-for-Profit Alliance works with business leaders, security leaders, healthcare, non-healthcare agencies, and make sure that they are keeping up the certification standards to the latest and the greatest to address the risks that either are there today or which are coming up in the horizon, and making sure that there is a checklist, certifiable framework to be looked at from an industry perspective. The strategic objectives is collaboration, efficiency, and consistent adoption of security within the industry. And so really it has provided a holistic method to ensure that there is a consistent deployment of security and privacy as it relates to healthcare within the industry. Key components of the HITRUST certification are as follows. Number one, they have a great tool that focuses and that is a questionnaire-based and a content-based tool that helps companies to do a self-evaluation from an overall perspective and from an overall risk exposure perspective. There are multiple assurance options that are available when companies want to go through HITRUST. There is a self-assessment option, but then there's also an option by which companies can use a third-party assessor that is certified to certify against the HITRUST regulations. Someone like ControlCase, who subscribes to the HITRUST methodology and is licensed to be able to certify against HITRUST by doing an audit with companies. The certified and the end result of a HITRUST audit. So there's a self-assessment which companies can do themselves and engage with HITRUST without using an auditor to attain a certain level of due diligence that's needed and a certain level of self-assessment that's needed. For the companies that do choose or have to get audited by an independent third-party assessor like ControlCase, the end result of an audit is a validated or a certified report that is issued in conjunction with HITRUST. So we, as the auditors, will work with the company to audit them, and then submit our findings to HITRUST, who does a great job going through it and identifying and ensuring that the audit has met a high level of standard to certify or to validate a company to the HITRUST standard. There are various other tools that come with it, including the maturity scores and so forth, so companies can gauge how they rank against someone else in the industry. And then, of course, as part of that, final reports, corrective action plans, and so forth are delivered. As we get towards the end of our presentation, we will spend the next few minutes talking about HITRUST certifications as a method to demonstrate compliance to HIPAA, and what we have seen in the industry as some challenges companies face in demonstrating compliance to HIPAA when they go through an HITRUST certification. Certainly we have seen across the industry where formal risk assessments, whether it's technical or physical, are not done consistently from an enterprise perspective. Asset management and inventory of assets turns out to be an issue commonly out there where because of the ever-changing IT infrastructure, it's hard to keep an up-to-date inventory of assets that exist out there. Next is business associates or vendor management programs are sometimes not implemented properly. From a vulnerability management and patching perspective, sometimes we have seen that a lot of companies have a difficult time on a monthly or a quarterly basis to run through the full life cycle of identifying vulnerabilities through vulnerability management and then patching them or hardening their systems for the vulnerabilities that have been found through the vulnerability management system. Logging and monitoring turns out to be a gap that we also observe consistently. The reason being that there is so much data out there and so many systems that consistently keeping up with logs is difficult. Monitoring logs 24/7 on top of that also becomes a even bigger challenge. And so we have seen logging and monitoring as being a challenge in the industry. A lot of companies have not appropriately touched or tested their incident and breach response documented processes and procedures, which is important because if there is something that goes wrong, it's important that there be a streamlined and tested and well-trained mechanism for folks to respond in case of a breach. User provisioning continues to be an issue, such as excessive user access or ability, sometimes user access is not revoked in an appropriate manner. And then the last one I'll talk about, which happens quite often, is encryption. And there are numerous instances out there where tapes get lost, physical media gets lost, which has healthcare data on it, and it has not been encrypted. So again, even now, that actually happens quite often where media, laptops, and so forth get that data on them, and then eventually they're lost, and that results in what effectively is a breach situation. So, in the second part of the discussion today, I went through HITRUST, and I talked about how companies can use the HITRUST framework to self-certify or use an auditor like ControlCase to certify them to the certify or validate them to the HITRUST standards. We talked about HITRUST as a good certification because HIPAA does not really have a certification, but HIPAA has a lot of laws. HIPAA is a law of the land and requires companies to be compliant and certifiably secure to healthcare towards healthcare data. Certainly, if you have any other questions, certainly feel free to reach out to us. You can get our contact information at www.controlcase.com. We certify companies to HITRUST, PCI, and a whole host of other IT standards and regulations out there. Of course, we're also able to do HIPAA audits, but there's nothing like a HIPAA certification. That being said, at this point, we will open up the presentation to any questions and answers that people may have. I will go and answer the questions in the order it is received. The first question is around if data and software that's used by a healthcare customer is deployed in a public cloud like AWS, is it sufficient if AWS is HIPAA compliant? And that's a great question. Typically, the public clouds like Amazon, Azure, many of them are compliant, and many of them are also certified to standards like HITRUST, SOC, and so forth. However, it is important to look at it from a point of view that these cloud environments are compliant or certified to areas which is in their scope. So the base infrastructure, the physical security, and all the things they're responsible for are covered if you're hosted there. However, an application being insecure or someone not patching their virtual images of operating system, that really becomes the responsibility of the company, and hence companies have to get compliant and are certified even though they are hosted in the cloud. The second question is, how can service providers get HIPAA certification? And service providers can get HITRUST certification by engaging an auditor like ControlCase, but they can also get a HIPAA audit or a HIPAA compliance audited, but there is no HIPAA certification. So the next question is it true that an organization should implement HIPAA guidelines to become HITRUST certified, or are HITRUST requirements and controls different? So think of it. So the answer is, think of it that HIPAA is the law, and there's nothing like HIPAA compliance. But if you get HITRUST certified, which is a certification, you are most likely you have covered the controls that would typically be required as part of a good standard HIPAA compliance program. The next question is, how do you determine if you're a covered entity? And so there's various areas that can be looked at when you talk about how you can determine whether you're a covered entity. Typically, if you come in contact and are responsible, either receive or pay, have billing and payments related to providing any healthcare services, or are receiving or sending, or any side of the chain of receiving or sending actual patient healthcare data, that's probably a good barometer to say that you're a covered entity. And so, patients, hospitals, sometimes clearinghouses are all good examples of covered entities. The next question is, looks like HIPAA requirements overlap quite a bit with PCI. Can you talk about this overlap? And so, first of all, whenever you compare two regulations, it is besides the audit points, you have to say that if the scope is same, then you're absolutely right. There's a lot of overlap between the different regulations, and within our platform, we have mapped multiple regulations, so companies can go through a single evidence collection exercise and then work on multiple certifications. So assuming it's the same environment or similar environment, there is a good 30 to 50% overlap between the two regulations that such as HITRUST and PCI. The next one is, how long does it take typically to get certified from a HITRUST perspective? It depends on the organization, but it could be anywhere from a minimum of 3 months to an average of 6 months is what it takes to get HITRUST certified. Next one is, what is the validity of HITRUST certification? The validity of HITRUST certification is the first year it's a full certification, and then the second year it's a minor certification, and then the third year you move back to a full certification. So it's an annual activity, but it's in 2-year periods. So the first year is a major, the second year is a minor, and then and again that cycle repeats. The next question is payment information related to the provision of healthcare in scope to HIPAA, even if there is no patient information included? So if it's payment information that is related to delivery of healthcare, then typically that organization would form a covered entity and would fall under the scope of HIPAA. Now, whether the actual card number falls in HIPAA scope is probably not that clear, or it might not, but certainly that entity would form as a covered entity if there's payment data going either way in the delivery or in the receipt of healthcare. The next and the final question we will take is, does HITRUST has a revision? Do people need to upgrade to the latest version? And typically the way that would work is when companies go for their recertification to HITRUST, it's typically done on the latest version. In the middle of the year, it's typically not necessary, even if a new regulation is released or a new version is released, to update the certification. It would happen after, in the, when the recertification comes up. Well, those were great questions. We thank you for attending this webinar on healthcare compliance. Again, we will be distributing a copy of these slides as well as a web recording. Please feel free to log on to www.controlcase.com, and certainly please feel free to sign up for any of our upcoming webinars, or go to our webinar section on our website to listen in on many webinars that we have done in the past. Thank you once again. Have a good rest of the day, and we look forward to seeing you on another webinar soon. Thank you.